Second white coat. Subscribe and like. Let's learn medicine together.
Welcome to The Explainer. Today, we are tackling a really fascinating medical mystery, one that starts not with a sound or a touch, but with a shimmering, warping light show that is created entirely inside the brain. I mean, just imagine this for a second. You're going about your day, everything's normal, and then suddenly, a piece of your vision just blinks out of existence. And in its place, this bizarre shimmering light starts to grow. What in the world would you think is happening?
Well, for one 22-year-old woman, this wasn't a hypothetical. Her world was suddenly distorted by this strange C-shaped puzzle. So we're going to follow the clues from her real-life case. Okay, let's dive into this.
All right, so first up, a shimmering medical mystery. Our story kicks off with this really alarming event that landed a young woman in the emergency department. So these are her actual words. It began as just a small blind spot, what she called a hole in her vision. But then it started to grow. It morphed and transformed into this shimmering C-shaped light on the edge of her sight. I mean, you can just imagine how unsettling that must have been.
Now pay attention here, because the timing is our first huge clue. This whole visual trip wasn't random. It followed a very specific script. The light show starts, it completely vanishes in about 15 minutes, and then, a few minutes later, this severe, throbbing headache kicks in. That sequence, it's everything. Okay, so we've got the patient's story. Now it's time to put on our medical detective hats. We're going to break down all the evidence, piece by piece, and see if we can solve this thing.
So our first and biggest clue is the visual event itself. Doctors have a name for this, an aura. And the key things to notice are that it spreads gradually. It's not instantaneous. It's what's known as a positive phenomenon, which means she's seeing something extra, these shimmering lights, not just losing vision. And maybe most important of all, it vanishes completely. This pattern is a textbook definition of a very specific neurological event.
Clue number 2 is the headache that came after. And look, this wasn't just any old headache. It was stuck on one side of her head, it was throbbing, pulsating, and it was so intense that when doctors found her, she was lying perfectly still in a dark, quiet room. That's a classic sign of photophobia and phonophobia, an extreme sensitivity to light and sound, another huge piece of the puzzle. And here we have it, the final crucial clue. After this whole dramatic episode was over, a full neurological and eye exam showed absolutely nothing. Zilch. Nada. This tells us that whatever happened, it was a temporary hit-and-run event. It left no lasting damage behind.
So we know what happened, but how? How does the brain just decide to produce its own private light show that then triggers a crippling headache? Well, the answer is pretty amazing. It lies in a kind of invisible wave that moves through the brain.
The culprit has this really intimidating technical name, cortical spreading depression. But don't let the name scare you. The easiest way to picture it is as a slow-moving ripple of electrical activity that washes over the surface of the brain. It's kind of like a neurological domino effect, where one nerve cell firing triggers the next, which triggers the next in a slow, steady wave.
So here's that chain reaction in 4 simple steps. First, the wave starts moving across the vision center of the brain, the occipital cortex. That movement is literally what creates the shimmering aura. Then, as the wave keeps going, it bumps into and activates the trigeminal nerve system. That nerve system then releases a bunch of inflammatory chemicals, and that's what causes the pain. The aura directly leads to the headache.
Now, to be really sure about our diagnosis, we have to rule out other conditions that can look similar. And this is a super important step, because some of these lookalikes are real emergencies. So let's take a look at the suspect lineup. First up, could it be a TIA, also known as a mini-stroke? Highly unlikely. A TIA is a sudden loss of vision, a negative symptom, often described like a curtain falling. Our patient's aura was a slow, progressive, positive symptom, a shimmering light being added to her vision. What about something like acute glaucoma? Nope. Glaucoma would cause a red, severely painful eye, and you'd see changes in the pupil. Remember, her eye exam was completely normal. A cluster headache? Maybe. The behavior is all wrong. This patient needed to lie perfectly still. Someone having a cluster headache is the total opposite. They're often restless, agitated, and pacing around. Could it be a seizure? Well, the timing doesn't fit. Visual symptoms from a seizure are usually really brief, lasting just seconds to maybe a minute or two. Her aura was a classic 15-minute event. It just lasted way too long. And finally, we can cross off optic neuritis. This is something where vision loss gets worse over hours or even days, not a quick event that's here and gone in 15 minutes. The timeline just doesn't match at all.
So, after reviewing all the evidence and eliminating all the other suspects from our lineup, we've got a clear and definitive answer. The case is officially closed.
This specific pattern, this shimmering blind spot, the scintillating scotoma that gradually spreads, completely resolves, and is then followed by that classic one-sided throbbing headache, that is the unmistakable fingerprint of a migraine with aura.
And while it can be a really frightening experience, the good news is there are very effective treatments. For the attacks themselves, NSAIDs or specific drugs called triptans often do the trick. And for people who get them frequently, there are preventative medications that can dramatically reduce how often they happen.
This case is just such a powerful reminder of the brain's incredible, almost alien complexity. It really leaves you with a final thought, doesn't it? If our brain can generate such a vivid, structured hallucination entirely on its own, what other hidden powers and mysteries is it holding on to?